Howdy y'all, Jeff here. I want to welcome you to the clinical paperwork video. So this is an exciting time. You're about to begin visiting the clinical and field sites and being able to apply what you've learned in the classroom to actual patient encounters. So this video will cover the basics of what the paperwork entails and how to properly complete the form during the rotation. I encourage you to grab some of your paperwork and have it available as we go over the different pieces. So let's just jump in. The first form that we'll look at is the rotation summary form. So there's a large colored form that's folded in half that has the PCR or pre-hospital care reports stuffed inside. The color of this binder varies by semester. So if you're an EMT student, it's blue. If you're an AEMT student, it's tan in your first semester, and then kind of changes for each semester after that. So these binders are also different for each rotation that you attend. If you look at the top left corner, you'll see that the level, site, and rotation numbers listed there. So at the very top of this form is the biographical data. So there's your place to put your name, the date of the rotation, the actual start time that you started your rotation, and then the actual end time. So if you stayed late, then you can just mark what time you left. If you left early, you also need to indicate that. And then just calculate out the total hours in the next spot. At the bottom of that is the date submitted, so the date in which you return this document to the college. The received by is something we fill out, so basically which faculty or staff member received it. And then if necessary, we'll return it back to you for corrections, which is the date returned, and then the date resubmitted is the date you give it back to us. So the next section lists the purpose, goals, and objectives. So this section changes for each location and potentially for each shift. So you should review these prior to arriving at the site. This is going to help you understand why and what you're expected to do. So the purpose is why you're going to this rotation. The goals are the broad learning points that we want you to accomplish. Most likely one of the first questions you're going to be asked is, why are you here today? Well, there's the answer to that question. And then the objectives list those specific tasks that you should accomplish or do while you're at this rotation. So again, these change based on each rotation and potentially each shift. So for example, your first ED shift has different objectives compared to your second ED shift. And then your first field rotation has different objectives compared to the next one. So look over these before you go, please. So now let's turn to the inside of the packet. Listed here are two evaluations. The left side covers the affective or professionalism objectives. The right side covers the cognitive and psychomotor objectives. Towards the end of the shift, you're going to give these to your preceptor and have them evaluate your performance for this shift. The affective evaluation covers character traits such as integrity, empathy, self-motivation, time management, and a few others. So for example, if your uniform is not pressed or if you were not prepared for your shift, then your preceptor or preceptors would provide feedback in this area. The grading scale is binary, so either you met the standard or you did not. The preceptor has three choices. If they did not see an instance of the trait, they're going to mark NBE or no basis for evaluation. If they did see an instance, then they will either mark yes or no. If they mark no, then you're going to need to make sure that they document why in the box below the evaluation. And then if possible, provide suggestions for improvement. You will also need to explain the situation and to provide a good plan for improvement. In regards to the affective objectives, we expect you to demonstrate entry-level traits at all times. So make sure that you read these, understand these, and know the expectations prior to arriving at the site. So on the right side is the cognitive and psychomotor objectives. These are also based on entry-level knowledge and skill. So early in the program, we expect you to actually be getting several no's, and that's okay. So you're still in the process of learning, you're still in the process of mastering these skills, and so getting a no early is okay. However, if we're at the end of the program and you're still receiving no's, we get a little bit more concerned as faculty and want to work with you to improve these. So the specific objectives change based on the shift and location. So please review the objectives prior to the shift. The evaluation scale is still the same as the affective evaluation. It's either yes, no, or no basis for evaluation NBE. There's also areas to document any no's at the bottom. So if your preceptor does give you a no, please ensure that they provide comments in the box. You will also need to be able to explain what happened and to provide a plan for improvement. The last step is to have the preceptor sign, date, and then print their name. Remember, in the emergency department, your preceptor is not the nurse, but the senior resident. Let's now take a look at the back of the form. The back also changes based on the location. In this example, you see a 1-minute reflection. After your shift, we ask that you think back on your experience. What did you learn? What do you need to improve upon? What's still confusing? We ask you to do this to solidify what you've learned, and then for you to identify those areas for you to go work on to kind of continue to improve so that you continue to grow and get better. We also ask that you complete an evaluation of the clinical site and your preceptor. If there's any areas of concern, please let us know. All of the clinical sites want to provide a great learning experience. So if there's problems, we can work on them to make changes for any, or to improve those for future rotations. The very last part of the form is your signature. By signing this when you submit it, what you're saying is that what you've completed is, so what you've submitted is accurate and complete and truthful. So next, let's look at the PCR, which is the pre-hospital care report form. So this page is specific, or the document is specific for your field rotations. You will complete one of these for each call or patient that you have. So if you have one call that has 2 patients, you'll complete 2 of these. If you have a call that's canceled, so you never actually get there, you'll also complete this form. This document is not used for hospital or ED shifts. So the top portion is for biographical data. So write down the date of the call, age and sex of the patient, and their chief complaint. On the left is the unit number, such as Medic 11 or Medic 22, and then the the names of your preceptors goes under the crew area. Next is the vital signs area. You should have at least 2 full sets of vitals, so the exception would be a refusal. Remember, when documenting for critical patients, the expectation is that you document vital signs every 5 minutes, on non-critical patients every 15 minutes. So if you have a critical patient and you were with that patient for 20 minutes, you should have 4 sets of vital signs. So when completing this, make sure that you're putting the time at the top. That's a common misstep that students forget to do. And then also just complete the rest of the table appropriately. Below the vital signs is the history section. This is where you will document your sample history. So make sure to include your pertinent negatives as well as positives under the signs and symptoms. So for example, if you have a patient that has chest pain but that does not have shortness of breath, both of these are significant and need to be documented. Next is the physical exam portion. So again, it's important to document the positive and negative findings. So if your patient was hit by a car, then you need to note that they do or do not have instability with their pelvis or their leg or any other body part for that matter. And then finally, there's an area for you to document the OPQRST portion of your history as well. At the bottom of the page is where you'll document the treatment that the patient received during the call and during transport. This should include both BLS and ALS level care. So if you're not sure of what occurred in terms of the ALS care, talk with your preceptors, talk with those paramedics, and have them explain kind of what they did and why they did it. You should also document your diagnosis, and I emphasize your diagnosis. The point is for you to learn how to work through the differential process and come to a conclusion about what's wrong with the patient. In order to treat the patient, you need to make a decision about what's wrong with them. Certainly you're learning as you go through this process, so if you need help, certainly that's what your preceptors are there for, and they can kind of help you understand how they made this decision But the point is, I want you trying to make this on your own before you go seek help. Finally, you also need to write the name of the hospital or clinic to which you brought the patient. Let's flip the page over and look at the back. At the top, you have a little more space to write about the treatment and history as needed. And once you have completed the report, you can write your name and then sign the form. Once you sign the form, it indicates that it is complete and accurate. At the end of each and every call, you should reflect on that call and think about what went well and what could go better. This is really what makes great EMTs and paramedics better. They think about the experiences and how they can improve, and then they talk about these with their partner. As students, we want you to do the same thing. As you're cleaning and getting ready to return to service and for the next call, we want you to think about 4 specific questions. So, what did you do well on this call? What things can you pat yourself on the back for? What could you have done better or differently? What did you learn from the call? And what's your plan for the next call? So, for example, if you struggled to get a good history that wasn't smooth, you had to think about what the questions are. So your plan should be to go back to the station, kind of think about the history, review those, and then the next time implement a change to make a smoother line of questioning. If you struggled through the patient assessment component, it wasn't organized, then you should go back and think about how to organize that better and to master that better. And then so for the next call, you can get better at it. So this is the documentation of those conversations. At the bottom is a place for your preceptor to sign, indicating that he's reviewed your paperwork and agrees with your documentation. Final document that we'll talk about are the competency checkoffs. You'll have several of these, and they cover different locations and skills. So look through your packet and find these, or find copies of these, so that you can kind of follow along. So the competency checkoffs are actual evidence that you're able to perform the skill to a standard on a patient. So for example, the one that we're looking at here is patient assessment competency for the hospital. The top line indicates the name of the skill and location where these should be obtained. While you have these out on your packet, go ahead and fill in the name and semester. You do want to guard these and not lose these, so you don't have to start over from scratch. Below the space for your name there is the standard to which you will be held. So please read through that so that you know how you're being evaluated. The next area is the preparation. So you'll need to be observed performing a skill a specific number of times. And so each checkoff form is different. So make sure that you're following the sheet and you know how many preparation or how many practice ones that you need to do in order to complete the form. As you're performing these practice areas, ask your preceptor to watch you as you do whatever skill it is that you're doing, and to help provide a little bit of feedback to help you improve. You cannot count the same patient more than once in this area. So you have to have 10 different patients in terms of like this form in terms of patient assessment. Like I said, use these patients to learn from, master from, so that you become very natural in this process. Once you've completed that preparation table, you can move on towards the final checkoff. During this final checkoff, you're not allowed to make any errors, so that's where that practice comes in the first several patients. If you do make an error, you'll need to find another patient to get checked off on. Once you perform the skill to standard, you can have your preceptor sign you off, and you're done with this sheet.